Mrs. Rita Bowman is an 80-year-old female who lives alone in a second-story walk-up apartment. Mrs. Bowman remains active in her church, attends a local senior center for lunch several times a week, and has 3 close friends who live within walking distance of her home. She has 2 children, both of whom are married and live out of state. She also has 4 grandchildren and takes pleasure in weekly phone conversations with the children. Mrs. Bowman weighs 170 pounds and is considered obese for her height of 5 feet 1 inch. She has a doctor whose office is around the corner from her home. She is currently receiving treatment for hypertension with nifedipine XL, 60 milligrams daily, furosemide, 20 milligrams daily, and potassium chloride, 10 milliequivalents twice a day. Her doctor is concerned that Rita may not take her medications as prescribed and requested a visiting nurse to determine medication compliance. Mrs. Bowman is on a reduced calorie, 1,800 calorie daily diet with reduced salt. She often says,
I cannot stand to eat tasteless food. A little salt never hurt anyone.
her doctor also recommended that she walk 2 to 3 blocks daily. She reports that her knees hurt whenever she walks and usually stops walking after a few feet. Mrs. Bowman's daughter calls her daily and is worried about her mother's health. Whenever she inquires about her mom's health, her mother changes the conversation to other topics.
I don't know why the doctor is so concerned about these pills. I am 80 years old already. I made it this far without these pills, and they make me have to go to the bathroom so often. It is really annoying. And I am not letting any nurse come into my home and tell me how to live my life.
Mom, the medications are really important to keep your blood pressure down. We've spoken about this many times. Mom, do you realize you have several risk factors for stroke? You're obese, you're African American,
Oh my, not again.
you have hypertension, and your advanced age?
Ruth, I don't have all the risk factors. I don't smoke, I don't drink alcohol or use cocaine.
We're lucky you don't have diabetes or AFib. And give the nurse a chance.
I feel fine. I don't think I have any problems with my blood pressure. Tell me, Ruth, how are the kids?
Mom, the kids are fine. I worry about you all alone. Please try to remember to take the pills. Mom, you know the doctor's considering having a visiting nurse come over. They might ask you several questions about how often you eat, what kind of foods you eat, and how you prepare your meals. They may even ask about your medication and check your blood pressure. It's only to help you, Mom.
A friend is visiting Mrs. Bowman. While having tea, her friend notices that Mrs. Bowman's speech has become slurred. 5 minutes later, Mrs. Bowman developed a right facial droop with mild right-sided weakness. She was transported to a local hospital's emergency department via ambulance. The acute initial symptoms began resolving in approximately 15 minutes while en route to the hospital. Upon admission to the ER, Mrs. Bowman was noted to be disoriented, aphasic, and had profound right-sided weakness. Her vital signs on admission were
Miss Bowman, I'm Dr. North. I will examine you.
Mrs. Bowman, I will be connecting you to the cardiac monitor and applying 2 liters of oxygen via your nasal cannula.
I don't know what's happening. Where am I?
Mom, I'm here. We are in the hospital. The doctor's going to help you, and I will stay here with you.
Did you know in the United States 795,000 Americans suffer a new or recurrent stroke annually, according to the American Stroke Association? We are concerned because African Americans have almost twice the risk of first ever stroke compared with Caucasians. And even though it is more common in men, strokes are more fatal for women. A transient ischemic attack also called a TIA, occurs when symptoms last less than 1 hour. If symptoms last beyond 3 hours, most will have evidence of a stroke on the CT scan. A stroke is a sudden interruption of blood flow to the brain, causing brain damage and loss of function. I am going to perform a series of tests to see if you have had a stroke, or to rule out other conditions. The nurse will draw some blood and first will test your blood sugar by doing a finger stick. We measured your glucose on admission to make sure your symptoms are not related to having low blood sugar. I will schedule you for an immediate CT scan of the brain. I will also be performing a series of exams that will measure your neurological status.
Here is more information regarding the National Institute of Health Stroke Scale. The NIH Stroke Scale is a 15-item neurological examination used to evaluate the effect of acute cerebral infarction on the following items.
Now I am going to begin several aspects of the NIH Stroke Scale exam.
The doctor is testing for facial palsy.
Please raise your eyebrows. Now please show me your teeth. Now close your eyes. Next, please squeeze my hands.
The doctor is now testing eye gaze and visual fields.
Follow my finger with your eyes.
The doctor is testing leg motor function.
Now I'll raise each of your legs. Please try to keep it in that position.
A stroke patient must have a complete CT scan within 25 minutes of arrival. The computerized axial tomographic scanner combines a series of X-ray views taken from many different angles with computer processing to create cross-sectional images of the brain called slices. The CT scanner views how the brain looks, works, and gets its blood supply. It can outline the affected parts of the brain. Using a non-contrast or dye-less CT scan is the most definitive way to differentiate between an ischemic stroke and a hemorrhagic stroke. It is the standard of care and must be completed within 25 minutes of arrival to the emergency department, and results must be read within 45 minutes by a radiologist. The nurse will now continue with the NIH stroke scale by testing for language recognition and dysarthria.
Hello, Mrs. Bowman. I'm your nurse. I'm going to ask you some questions. First, look at this picture and tell me what you think is happening.
What?
What month is it? How old are you?
Huh?
Please read these words.
What?
I don't think my mother understands any of this right now.
I understand. It is important that we ask these questions so we know how your mom is progressing. Mrs. Bowman, I'm going to give you some medication, CPA, to dissolve the blood clot. But first, I'd like to know what meds you take at home.
Huh?
My mother's medications included Procardia, Lasix, and potassium, I think. I'm not sure if she always remembered to take them, though.
Next, the nurse will perform a dysphagia screen.
I appreciate your help. Next, I will see if your mom can swallow. We cannot give her anything to eat or drink until we are sure. I will see if she can swallow her own saliva, if she is drooling, and listen to her voice quality to see if she sounds wet or gurgling. I will then wait 2 minutes and sit her up and repeat these observations. The Glasgow Coma Scale is based on the following chart.
Mom, the nurse is going to look into your mouth now.
I will carefully monitor your mom for the next 2 hours to make sure there are no adverse effects from the medication.
The nurse measured the patient's blood pressure and oxygen saturation. Here are the results.
Mrs. Bowman, I'm going to start an intravenous infusion and then give you some medication to dissolve the blood clot through this line.
What medication? Is this safe in my mom's condition?
Yes. Before the doctor decided to prescribe this medication, we made sure to go through the following checklist. We carefully calculated the exact dose of medication for your mom.
Okay, thanks. It helps when I understand what's happening so I can tell my mom.
The nurse reviews the order for TPA and calculates the dose, confirming it with the doctor and another nurse. To calculate the dosage in milligrams of the tissue plasminogen activator, TPA, the patient's weight in kilograms is multiplied by the recommended dosage in milligrams of the drug per kilogram. In this case, Mrs. Bowman weighs 170 pounds, which converts to 77.3 kilograms. This is then multiplied by the recommended dosage of 0.9 milligrams per kilogram, resulting in a patient dosage of 70 milligrams. Note that there is a maximum dosage of 90 milligrams per patient. CPA requires an initial bolus of 10% to be administered within 1 minute. The remainder will be infused over an hour.
It is also essential that this medication is given in a timely manner. TPA must be administered within 1 hour of emergency room arrival and within 3 hours of symptom occurrence. I will monitor vital signs every 15 minutes for the first 2 hours after the administration of TPA for possible adverse effects.
After 1 week, Mrs. Bowman has regained some strength and function of the right extremities. Her speech is improved, but residual dysphagia and speech slurring persists.
Mrs. Bowman, you're doing better. I would like to speak with you and your daughter about what assistance you will need when at home.
Oh, I'll be able to manage, okay? I'll go to the senior center for lunch, and I have my friends.
Mom, you'll need more help now. You still have some trouble walking? How will you cook?
Once Mrs. Bowman is discharged from the rehab facility, she will need assistance at home. She will need someone to assist with her ADLs, bathing, laundry, cooking, and cleaning. Mrs. Bowman will need support from her family due to the change in her independence. Safety at home has to be assessed.